Hey guys, Vlad here with Dr. OT. As some of you already know, I'm an occupational therapist and I've worked in the home health setting all of my OT career. As a result, I have to bring my therapy tools with me on the go every day. Today I would like to share the most frequently used home health tools for occupational therapists and what I carry with me every day in my mobile therapy bag. I purchased this navy blue original home health shoulder bag from Hopkins Medical Products online. This bag can also be found online in a black color. It sells for about $31. This really is all the bag you could possibly want. It is made of waterproof, easy to clean nylon, really universal and a fairly decent size. You will tend to agree with me once you see all the tools that I'm able to fit inside of it. It has one fold-down compartment with two mesh pouch pockets, one main compartment with two mesh pouch pockets, one secondary compartment with no pockets, one lockable HIPAA-compliant file folder pocket, and two large end pouches for phone and hand wash supplies with zippered closings. So now, let's take a look at what I have inside the bag to give you an idea of what tools I use on a daily basis. Some of the most frequently used tools that I have are blood pressure monitors. You're going to be taking your patient's vital signs every day as required per Medicare guidelines. I have several blood pressure monitors, two electronic blood pressure monitors, an upper arm cuff, BP 786N, and a wrist cuff, BP 652N, both from Omron. I religiously use the upper arm cuff all day long and seldom use the wrist cuff because of its inaccuracies. I also have a manual blood pressure cuff and a stethoscope from Medline, which I turn to if I have a concern with a patient's blood pressure, whether that be a blood pressure reading that is too high or too low, or if I can't get a reading at all. Also, I have a pulse oximeter from Facelake, which I also use religiously all day long to check heart rate and oxygen levels, especially with those patients who are on supplemental oxygen. I have a temporal scanning thermometer that I use to measure body temperature. This is especially important today during the time of coronavirus. I bring the blood pressure monitors, pulse oximeter, and thermometer everywhere I go. They are crucial for assessing vital signs. I have a regular size gait belt in my bag, but I now always carry a spare in my car. I learned to do that when I left a gait belt at a patient's house, not once, not twice, but 3 times. 2 of those times around a patient's waist. Has anyone else done that, or am I the only one? I carry 2 standard goniometers, one big goniometer for larger joints like the shoulder or knee, and one little goniometer for smaller joints like the elbow and the wrist. I don't use these frequently in home health as I'm not generally looking for very precise range of motion measurements, but rather functional measurements. I have a reflex hammer that I use most often to evaluate deep tendon reflexes with patients with CVA. I always have a set of universal wrist or ankle weights in my bag. When I say universal, I really mean it. These weights can easily be adjusted from 0 to 5 pounds. Each of these metal inserts weighs approximately half a pound and can be adjusted in a matter of seconds by inserting or removing these metal weights. Everlast makes these. I actually found them in a thrift store for a couple dollars. Probably one of the best thrift store purchases for home health that I've made. I always have elastic band in all colors, but only keep yellow and red elastic bands in my bag because most of the geriatric patients I work with typically are unable to tolerate any resistance level greater than yellow or red. I do, however, have every available color in my car just in case. I bring my handy dandy reference clipboard every day, which I purchased during OT school and which I occasionally reference for dermatome and myotome distributions, cranial nerves, CVA effects, spinal cord injury function, range of motion norms, manual muscle testing grading scale, deep tendon reflexes, and edema scale. I also have hard copies of standardized ADL assessments, the CATS Index of Independence in ADLs, which is used to assess functional status as a measurement of the patient's ability to perform activities of daily living independently. The Barthel Index of ADLs, which assesses the ability of an individual with a neuromuscular or musculoskeletal disorder to care for himself or herself. I also have the St. Louis University Mental Status Exam, which is used to identify persons who have dementia or mild neurocognitive impairment. I always have a couple small travel hand sanitizer bottles. I also keep a larger bottle of hand sanitizer in the car in case I run low. I have a separate Ziploc bag for rubber gloves because you never know what you're going to walk into or what you're going to be touching, especially during coronavirus times. I also have alcohol prep pads to quickly sanitize tools, hand sanitizer wipes just in case, and Clorox wipes in my car. You can never have too many sanitizing supplies. Be sure to use a barrier between your bag and the surface on which you set your bag down. Don't forget to wipe down and sanitize your tools before putting them back into your bag. Be sure to follow your company's protocols with state regulations in mind. I keep CPR face shields in my bag, though I've never actually had to use one. I have a small measuring tape which comes in handy for taking edema measurements, and as a certified lymphedema therapist, it is essential to be able to take circumferential lymphedema measurements. I always have a pen and a dry erase marker in my bag, at least one of each. These come in handy more often than not. Be sure to never go without one. Lastly, probably the most important tool that I have with me every day in my bag is my iPad. I use this thing all day long with every patient, even if it's just to document vital signs. Starting with obtaining patient demographics, including name, address, and phone number, to looking up patient history, such as medical history, hospital and insurance documents, as well as multidisciplinary paperwork, and ending with scheduling future appointments and documentation following each of my patient visits, and especially so when I have cancellations. I complete my evaluations, reevaluations and reassessments, discharges, and physician's orders all from the iPad. But most importantly, it is used for its map capabilities to be able to locate my patients' homes. Thanks for looking with me into my mobile therapy bag. These are the tools that I bring with me inside each of my patients' homes, many of which I absolutely use on a daily basis, and some of which I use multiple times during each appointment. These are the most used tools that I have for the home health setting. Just wanted to give you all a sneak peek of the most common tools that I have, a look inside my mobile therapy bag. When I was making this video, I thought about all the fancy tools that I've seen other home health occupational therapists using. And you might come across them yourself when you're looking for a way to expand your skill set or taking continuing education courses. I caution you in doing that and encourage you to think about all the tools that you already have. Think about the tools that are available today for you to use. Don't get caught up in the hype of purchasing super expensive equipment that will cost you more than my home health car. Having the right tools for the job can make all the difference, and these tools are absolutely essential for me in the home health setting. So I hope you found this video to be helpful and valuable, whether you're just beginning your career as an OT or your career is nearing its end. Hit the like button below if you found value in this video. Also be sure to hit the subscribe button below for more content from the Dr. OT channel. I will see you in the next video.